The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, Dr. Seberg. Dr. Seberg, welcome to the program.
Hey, Randy, it's good to be here again.
Now, you know, my program's been out about 12 years, and you were one of the, probably 10 years ago, 10 years ago, somewhere in there.
It was.
I interviewed you, very impressed. So for people that don't know you, you have practices now, I guess, all over Orange County. And tell me a little bit about who the typical patient and the type of procedures you do.
Well, Randy, as you know, my practice is limited to exclusively implant surgery and reconstruction.
So just dental implants?
Just dental implants and the reconstruction that goes with it. You know, the reason people come to me is for teeth. They don't come to me for implants.
All right.
But so I do the implants and then the teeth that go on top that changes their life form.
So you did your first implant in 1974?
I did.
Not a lot of guys doing them back then, you said? Is that right?
Randy, I was actually, my peers considered me a charlatan.
Really?
They said, that doesn't work. You can't do that. And there were a few other people around the country doing it. And that's how I learned. I had to travel around the country, go talk to other guys.
But why your obsession with it? I mean, why did you like dental implants early on?
Well, my real passion, my real background is making teeth for people. Okay. And a lot of my patients they didn't have any teeth, or they were missing quite a few. And I would make them the traditional denture, the traditional partial denture. And I was never happy with it. And guess what? Patients were never, ever happy with it.
Okay.
And so I thought, well, there's got to be a better way to do this. And some of the real leaders, I was a follower, an early follower. And some of the early leaders, I would see things in print, I'd hear about them. And so I started traveling around the country, going to their offices, seeing what they were doing, and then maybe getting a lecture from them here or there. There was no formal education in the dental schools at all.
Okay, okay.
And so I thought, maybe this will help me satisfy these patients. And so I started doing my own implants and placing the own implants. And it did. It made my patients happy, and guess what? It made me happy because my patients were happy. And that's how I got into it. Okay,
now you're a diplomat of the American Academy of Oral Implantology.
That's correct.
Right? That's the highest you could go in that.
That is American Board of Oral Implantology.
Only about 400 or 500 guys in the world with that.
That's correct.
And also, you fellow of the American Academy of Implant Dentistry. I guess on and on and on. And you do the teeth in a day, things like that.
Yes, have been doing that for a long time.
Now, we should also mention your background, because from 9 years ago, I didn't realize this. Your dad was a dentist.
Yes, he was.
And more dentists in the family as well.
Yes, he had two brothers. So I had a father and two uncles that were dentists, and they were dentists in rural communities in Nebraska. That's where I grew up.
So what's changed in the last 10 years, 20 years, or since 1974 with implants? Why is it what used to take you guys a year now could be done in just a visit or two? I mean, what's happened?
Oh my goodness, Randy, the change is incredible. What I did in 1974 and what I do now, they bear no relationship to each other. Well, probably the biggest thing is the shape and the materials, and the shape of the implants have changed. They're much more engineered than they were then. And the coatings on the implants have enabled us to go from taking 6 months to put a tooth on it, or even longer, to, believe it or not, we can put a tooth on it that day.
That same day?
That same day.
So that's not an exaggeration when I hear stories of going in, getting an implant, getting a tooth on top that day. That can happen.
No, my first one I ever did, 1998, I'll always remember it.
You'll always remember that.
I always remember, because it was a significant thing. I'd been reading about this and thinking about putting teeth on the implant at the same time. And so one day, this very, very nice lady came into my office, but it was easy to see she was in distress. And what had happened was she had, we call in the biz, a roundhouse bridge. It was a porcelain bridge that went all the way around, all one piece.
Okay.
And it was held in by maybe a half dozen teeth, traditional. And all the roots had gone except one. And when she had opened her mouth, the side of this bridge just fell down. If she opened her mouth, it just fell down. And she was scared to death to open her mouth. And I looked and I said, oh, we've got a problem here. So I started to tell her what we were going to do. We were going to have to take the roots out and put some implants in, because that's what she wanted. That's what she came to me for.
Okay.
And then she was going to wear a denture for a few months while it healed. She said, oh, I can't. I won't do that. I won't do it. I just won't do it.
Wants it that same day.
So I said, well, you know what? We can try this. And I advised her of everything. And she says, that's what I want to do. She came in and we had some time. I worked an extra day, came in next day. She was asleep, totally out, comfortable. And took the one lousy tooth holding that whole implant bridge out. And I worked for several hours. Got all of the implants in, put in 10 implants, and put her teeth, attached some teeth to that the same day. She woke up.
Sounds like a lot of pain, though.
No.
Really?
No.
Okay.
No. If for the single implants, for the one implant, typically what I'll hear, honest, is they'll say, you know, all these medications you gave me, because I always set them up with the proper medications before you do the. She says, I didn't take any of it. What do I do with it? I said, well, wait till you got, stub your toe or something. Okay. All right. But
that woman didn't complain about pain, and she's eating and chewing. She has teeth on top of these dental implants.
That's right. Yeah, she did.
And did that change your whole career when you saw it happen?
Yeah, absolutely, absolutely. And then I realized that this teeth in a day concept, in most circumstances, not all of them, but most of them, is a valid concept.
And you teach other dentists this, right? I mean, you teach implant dentistry. You lecture to other dentists.
Yes.
Now, your office, you guys also do it a little differently. You do the surgery, and then you also put the tooth restoration.
That's correct. Yeah.
And is this true? How it's normally done is you go to one person for one thing, another person for another thing. Is that right?
That's the large percentage of it.
Okay.
Yes. Mm-hmm.
Is there an advantage to doing it the way you're doing it, you think?
Well, I think you'd have to ask the patients. Okay. If you think about it, who wants to go here, and then here, and then cross town over here? If they can come to one place, that's what I always hear from my patients. I'm so glad that
because people don't like going to the dentist, right? I mean, nothing has changed there.
Are you kidding me? I mean,
really?
Randy, I'll be out in a social setting, and I meet someone for the first time, and conversation, nice polite conversation. They'll say, "Well, what do you do?" And we're having a nice conversation. They smile at me, and a nice conversation. And I'll say, "Well, I'm a dentist." Honest to God. Oh.
They cover their teeth.
Yeah. People, we've got a bad knock.
Okay, so let's move into the categories of dental implant patients that you see.
Well, that ranges from the person who's lost one tooth.
Okay.
All right. And they don't want to have the adjacent teeth cut down and the traditional porcelain bridge attached. So you wreck two more teeth to replace one. They don't want that. Or they don't like the removable tooth, the thought of that. And
those are the flippers? Is that what they're called?
That's the flipper, yeah.
Is that still being done today?
Yeah. Okay. Randy, you have good teeth,
Don't hold
though.
back here. Yeah,
you have good teeth, don't you?
Teeth, right,
You've never experienced anything like that.
Never lost a tooth or anything.
You never lost it, okay. Well, you can't possibly understand what it feels like. See, I understand. I've got 3 implants.
Oh, you do?
I have 3 implants.
Okay.
And I had a little accident, and I lost 3 teeth. And I have good teeth other than that. And they got shattered. That hurt. The breaking the teeth, that hurt. So, but this was a few years ago before we did the, teeth in a day thing.
Okay.
And so I went to the dentist. He took the teeth out and he put the implants in. But I had to wear this removable partial, the flipper, 3 teeth.
Just while you were waiting?
Yeah, okay. I had to wear this thing. And it's so foreign in your mouth. You try to eat, you can't eat. I put the glue in it to hold it up, and because I mean, I'm a dentist. I got my, teeth. I had to look good. I mean, I had to look normal. But I couldn't wait to get it out. So when I'd go out to lunch, this is a true story about myself.
Okay.
So
okay.
when I went out to lunch, I'd take the darn thing out and I'd put it in my pocket or set it on the table and eat my lunch. And then I'd go back to the office. And one day, I'm sitting there, and I'm talking to a patient right after lunch, talking to him about it, And I happened to glance up, and behind the patient's my assistant kind of like this at me. I just glanced up, and she goes,
"You forgot to put your..."
I hadn't put my teeth in.
Okay.
And so I had to get up and, of course, go put it in. That's what our patients deal with all the time.
Interesting.
It's embarrassing. It's humiliating.
Now, you're a dentist. Of course, you think the teeth are important.
Well, aren't they?
Okay. So you think a smile is pretty important?
Oh, for heaven's sakes!
How important is it?
The way we communicate with the world is with our smile. And if you can't smile, what's the world going to think of you? And think of the patients that have the removable teeth, and they're afraid to laugh.
Okay.
Because it'll
Do they
fall
tell
down.
you that?
Do they tell me that? Of course they do. It's embarrassing. Look, I've seen so many different patients that they come to me with the removable teeth, and we get them into their first set of permanent teeth, and they don't come out, and their smile changes.
Is that right?
Oh, I take before and after photos, and the first photo I take of them is,
you can't get them to show their teeth.
No. When I get finished, the smile, yeah.
And backing up about categories of dental implant patients. So is it true? Okay, so 2 dental implants, you can give somebody something that snaps in and snaps out.
Yes, you can. If I might show you, there's just a little.
You show this to patients.
Yes. And something. This is actual size, and that's how small it is. And then these snaps, the denture snaps on, and I mean, they can eat what they want. It doesn't slide around, doesn't move. They don't get the food underneath it anymore.
No more adhesives with just 2?
No. They don't use the adhesive anymore. And I know from personal experience from the time I had the adhesive in my flipper, it really wrecks your sense of taste. I mean, how would you like to eat a nice steak and it tasted like denture paste?
Did they tell you that really?
I know it's true.
Now, I know a few denture wearers. I mean, obviously this is not something to talk about, but are you saying that pretty much all denture wearers are miserable? Or just not happy?
They're not happy, and most of them are miserable. But if you ask them, they'll say, no, it's wonderful. I'm so happy I got my teeth out. But as compared to what? They're happy with their denture as compared to where they were before, because the way a person typically loses their teeth, is one tooth here. Root canal failed, out goes the tooth. Then another one. Then they get some pyorrhea, get swelling and infection, some pus. Hurts. So they get those teeth out. And they eventually wind up with a denture. Well, the denture is far better than the pain and the misery.
Good point.
Yeah, as comparison. But as compared to a normal set of healthy, non-removable teeth, doesn't even come close. I mean,
so they forgot what it was like to chew.
Of course they have.
About their teeth.
Of course they have.
This is interesting because if it's as good as you say it is, and there's got to be at least 50,000 or more in Orange County alone that have dentures, upper or lower denture, right? Why aren't they all doing it then? They don't know their options.
I think
they don't think they're candidates.
Well,
afraid of pain.
They don't. Well, you've hit it all.
Okay, I'm on a roll here then.
Yeah, you are.
I'm sorry about taking that away from you.
No,
I couldn't control myself.
First of all, it's typically they don't know what can be done for them. Secondly, it's fear. They're afraid it's going to hurt.
Of the pain.
Yes.
Is that right?
Yes.
It seems painful.
No, I know it seems like
it, but I don't quite get why they don't.
If you look at it, you'll go, "Oh my gosh, that must really hurt." But you have to remember, with the newer techniques today, when we're using guided surgery, CAT scans, and guided surgery, in many instances we use that. Then there's hardly any incision. The incision's what hurts after they're done. See, the bone doesn't have any nerve endings in it to speak of, so you can put something in the bone and it doesn't hurt. because there's no nerve endings to tell you it's painful.
All right.
It's the incision in the gum that usually is.
So that's been minimized because of the new technology.
Yeah, it hardly bleeds anymore in those cases. Another reason why they don't have anything done is they really don't know their options. See, they get a set of dentures and they think that's it, they're good, that's done. And then they go get them relined every 7 or 8 years. And that's the only time they go. So because they don't go, they don't talk to anyone about it. Denture wearers don't talk about their dentures to their friends.
Okay.
No, they don't talk about it. That's embarrassing. They don't want anyone to know that. Would you tell people?
Laugh, yeah.
All right? They just don't go. They're afraid. They don't think there's anything that can be done for them.
What about this, though? And I've said this on other programs that I've done, that it's like my mother's 74 years old. Her medical doctor says you're too old at 74 to get dental implants and they might fall out.
No.
But do you think that's a common, and you guys say, no, that's not old at all.
No, it's
nowadays.
It wasn't old. No, it wasn't old years ago, and it's not old now. And I don't know. I hear that all the time.
You do hear that?
Oh, everyone comes in and they'll say, gee, I'm afraid I might be too old. My eldest patient that I placed implants in was a wonderful gentleman. His name was Elmer. Came in, he was 93 years old.
Is that right?
Yeah.
Okay.
But he said, well, I want some teeth. And he had a few teeth left of his own, but he says, I want some teeth. And I thought, okay, so I started to tell him that I'd make him some removable teeth because I'm 93 years old. And so he says, no. He says, that's not what I want. He says, I came to you because you say you do implants. He says, I want some implants, and I want teeth that don't come out. That's when I learned that.
Because you were even afraid at a 93-year-old to give him something fixed.
Yeah, I thought he'd think I was nuts. But no, he wanted something that was going to improve his life. He spent a lot of time out amongst the public and did a lot of socializing, and he was tired of these.
So what happened to that guy? So 93, you did the case.
I did it.
And what?
That was maybe 10 years ago.
So eating, chewing, I mean, what I mean is his outcome. I mean, how'd it come out?
Well, you should have seen Elmer's smile. Okay. He was happy. He was happy. He could eat whatever he wanted. And when we get older, for many of us, the eating
your life revolves around socially eating if you're lucky enough to retire.
Yeah. And have you ever been into a retirement home? Your mother's not in a retirement home.
Actually, my mother is, yes.
Okay.
And I've been in there.
Okay. If you go into a retirement home, you'll see a lot of people if they don't know you're there, without any teeth in, right?
That's right.
And or you go into the dining room, and and they'll all be sitting there eating, and they'll have their dentures beside them. You come up to speak to them, and they put them in. They don't want to be embarrassed with.
Interesting. Or it takes them forever to chew with their dentures.
Well, and they're so miserable. They hurt. They slide around.
Is that right? So the denture wearers that come in for the consult, they tell you it hurts.
Yes.
They slide around.
Yes.
Just not happy.
Oh.
But doesn't everybody want fixed? You mentioned the options of 2 implants to snap in, snap out. They can still eat and chew. But doesn't everybody want something fixed that doesn't come in and out?
Yes, they do.
So that's an option.
That is an option. It's the best option because that's the way you return yourself as close as possible to when you were 20 years old and had all your own teeth. And it's the way you return to your youth when you could laugh, you could smile, you didn't worry about things falling out, you could eat a steak, you could eat what you wanted.
Can you make them look good, by the way, like regular teeth?
Absolutely.
I feel like I could spot a denture,
Well,
they seem perfectly blocky, perfectly straight. What are you doing?
You're spotting a bad denture.
Okay, good. We're going to take a quick break. We come back. More about the process, what they expect on day one. Okay? You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about dental implants. We'll be right back.
I'm deathly afraid of the dentist, and when I came to Dr. Seberg, I was very concerned not only about being here, but about the pain associated with it. He offers the option of an anesthesiologist actually coming in, and there was no pain. After some of the major procedures, I took some medication for a few days, but by and large, he alleviated all my concern, and I was relatively pain-free most of the time.
I didn't want to laugh for the simple reason I had missing teeth. Because I didn't take care of it, I had the one tooth got kind of swung over, and I sort of pictured me with my little half smile and the tooth was sticking out. I looked like Bugs Bunny. And I said, oh God, that's the end of that.
I went in, I paid to get an examination, and for the full x-ray situation, tell me what I was faced with. I wasn't comfortable. I finally found Dr. Seberg. It worked out wonderful. It was an experience that you go to sleep, you wake up, and all of a sudden you're a new person.
I look better to myself and the people around me because of the cosmetic benefit. Oftentimes when you have a loss of your front teeth, there's a chance that your mouth is going to cave in, so to speak, and that you're going to lose part of the original profile of your mouth and everything. But with these, I never did lose that.
When I came to Dr. Seberg, my teeth were really bad. I neglected them to a certain extent. I had genetic problems, and I didn't know if I was going to wind up with having all my teeth pulled or if there was other options available to me, and he showed me that there were, and I'm quite grateful that I came here.
The biggest thing for me was it felt good. I felt like it was my own teeth. I couldn't believe it. I felt that it was just fantastic. And of course, the looks, I was never so happy in all my life because I had suffered for many years with a mess.
I walked out of this office and he said, go enjoy yourself and eat anything you want. I said, anything? And he says, I said, I can bite an apple. He says, you can chew on a steak and you can fight a dog for the steak. That's how strong they are. And I have a dog, but I wasn't about to try.
The procedures he did on me were a success. I feel much better now. I believe I look better. I'm a lot more confident in my appearance, which in my profession is quite important. I think if I had to summarize my feelings about Dr. Seberg in just a very few words, I would use compassion.
I didn't know that dental implants could feel like they're mine. And I defy anybody to tell me they're not mine. But they are.
If they knew the improvement that getting these implants would make on their life, there wouldn't be enough hours in the day for Dr. Seberg to see them all. It's that good.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about dental implants with Dr. Seberg, and he's been placing, I guess, implants since 1974.
That's correct.
One of the pioneers in this, and you do teeth in a day.
Yes.
So people that are watching, okay, ideal situation we'll talk about. Somebody, 65, 70, can go in your office, and if everything works out well, okay, you have the imaging and things like that, they can have implants placed and walk out with a set of teeth. Is that true?
That's true.
In a great situation.
In the ideal situation, normal situation, yes.
I know your patients like you. I met your patients in Las Vegas, I guess 9 years ago.
Yeah.
And every one of them, I'll never forget. And we have some grainy footage of those people, but they sounded like they were exaggerating. About how just their whole life improved just because of dental implants. And it made me actually appreciate a little bit more about what you did, because when I don't think about it, because it's not something I think about. Yeah. But those patients that we saw, and I showed the videos there at the break, that's typical. I mean, people are that happy.
Yes.
When you give them their teeth back.
Yes. I mean, once again, I go back to, you just can't possibly appreciate what they feel before they have this done. I mean, I have a little taste of it because I have some implants myself. But until you've, what's the old saying, until you've walked in their shoes, how could you possibly understand what they feel? I mean, I've many people, tears, they're so happy.
Really?
Lots of hugs. Randy, it is so gratifying to take someone that is they're a dental cripple. They've been wearing dentures for 30 years. They have no bone left to hold anything in. And the denture flops around in their mouth. They have sores. And to have them come in, and in one day, you put the implant in, you put the teeth on it, and you wake them up, they go home, they come back a couple days later for post-op, and they say they can't believe that they don't take their teeth out to eat, or they just can't believe what's happened to them.
Is that right?
Yeah.
You like that? I mean, you enjoy this.
Oh, yeah.
You think it's the happiest group of patients in all dentistry? Is the people with no teeth, and obviously,
Yeah, they are far away, in my experience, and it's been a lot of years, the most grateful group of patients that I have are the people who they don't have any teeth, and all of a sudden they do, and their life changes.
So, consultation, we're out of time. Okay, so somebody watching this with a denture, missing teeth, they're afraid, whatever, starts with a consultation.
Yes.
They go in, they get on your calendar.
Yes, and then we sit down and we talk. First of all, we've got to find out what it is they want, what they're feeling, what their expectations are, what they would like to have. And then we talk about, well, what some of the possible options may be available for them. And after we've talked a great deal, learning what it is that they want, what their expectations are, what will improve their life, then we do a diagnosis. We get the necessary x-rays, CAT scans, whatever it takes, and we come up with a treatment plan. And I'll usually have at least 2 options for them, sometimes 3, and we discuss it. And we can discuss how it fits into their financial resources and whether it fits into their life. How long will it take? They want to know, how long is it going to take?
Yeah.
Okay, that's very important. I mean, if you tell
and even 90 years old, I mean, that's the thing that's most surprising. Even if you have a little bit of osteoporosis,
absolutely,
things like that.
Absolutely, Randy. Everyone, if you're 70, 80 years old, everyone has osteoporosis.
Okay, good point.
And it's only the ones that are so severe they can't even walk that may not be.
But is it true it's very rare that somebody's not a candidate for some type of procedure?
Extremely rare.
Over the years? Okay.
Extremely rare. It's only a few limited health issues that cause that.
Okay, good. I want to thank you for coming. Always a pleasure. And they get to meet you. You're not too busy. They still get to see you on the console.
Only me.
Okay, good. I want to thank you for coming on the show.
Thank you, Randy. I enjoyed
Great stuff.
it.
Great stuff. You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website, put in Dental Implants Orange County or Orange County Dental Implants or Dr. Seberg, of course, and you'll find it right there. For now, I wish you good health.